one thing I didn't mention in my presentation was surveys have been done about, actually by the Harvard School of Public Health, of the people affected by the mandate in Massachusetts. And while some 20% say that the mandate is helping them, 60% of the people affected by the mandate say it's hurting them. So we have this kind of feel-good, let's all go help the uninsured mentality here in Washington. But in fact, once you start inflicting this on the people you're trying to help say it's hurting. So it makes no sense whatsoever. And to my mind, the employer mandate, the individual mandate, if we want freedom in this country, we can't mandate health insurance.
And I would just add one more piece, which is the entire cost of it. It's not working. So, the entire cost of this. Someone's going to be held paying for all this. And I went through the list of new taxes. Many of those are taxes below people earning $250,000 a year. So there is no doubt that this is going to impact not only families, but it's going to impact jobs. It's going to impact wages that people get. This is something that we're now starting to open up a new front on, which is what is the impact on employment? We're in a recession right now. The economy is not improving as they said it would. This is just going to add more problems to the economy, not solve them.
If I could follow up on that. Suppose the public option was dropped. How does that affect the cost?
The cost is actually subsidizing, as I said, the largest piece of the cost, the overwhelming, I think almost 80% of the cost is subsidizing people to buy health insurance.
Regardless of where?
Regardless of the public plan. It is how much you have to bribe people to offset the very expensive health care plan they're going to mandate you to buy. That's where the cost comes in. And then the second biggest cost is the Medicaid expansion, which I said is almost equal to this subsidy. So you're going to be spending tons of money on a subsidy, and you're going to be adding to an entitlement program that's already broken.
So that the numbers that Greg and Dan talked about are just federal numbers.
That's right.
It's not the state numbers. And we have $500 billion deficit right now at the state level. So it doesn't even cover that.
And just on that point about the federal states, originally Obama had said that he was going to offset the costs for the states. But guess what? That makes your price tag even that much higher. It would have probably topped $2 trillion if he said they weren't going to have the states pay for anything. So again, it's to that push and pull. How are they actually going to bring this cost down and actually have an impact like they say they are?
Just one thing on the 10-year projection. Steve Parenti and some fellow economists at the University of Minnesota costed out the House bill, and they found that the House bill would cost $3.5 trillion over 10 years. So, I mean, that is as much additional spending as Bush was spending. It was additional deficit spending. This is all deficit spending, by the way. Yes.
Starting with Rick and the rest of you, please comment, but on just the basic fundamentals of the thing, isn't it simply a matter that we got $2 million chasing too few goods, and frankly the best thing to do would be to increase medical school enrollment, and if we were going to have a government program, it would be funding doctors coming out in medical clinics to set up under your model and get more healthcare professionals out there, more people, and really have a market effect of forcing things down. And the second corollary to that, the only way I can see it getting that $700 billion savings, which is fantasy, as you pointed out, is if they do something to clip the wings of the trial lawyers, which is my nasty profession. But anyway.
20 years ago, somebody asked me about how much money was spent on the last 6 months of life. The best answer is tell me when it starts. I mean, how are you going to get that savings? We don't know when we're going to live and when we're going to die, and when we ought to be spending money on ourselves, and when we should. I personally believe free market works. I think that if government got away from healthcare and quit having all the mandates, quit having all the rules, the system would fix itself. Because if you can think about it, if I can run clinics and I can take 70 to 80% of people that go to an ER and make a profit at 1/6 the cost with insurance, there's opportunity. But the government can't get it. The only way it's going to happen is if you as an individual figure out how to allocate the dollars. The government can never allocate the dollars well.
Right. And the evidence behind that is powerful. we've had a consumer-driven healthcare for 6 years now. We have real-world, real market data showing that the costs are down. The rate of increase of costs are about half of what it is for HMOs, PPOs. Patient behavior is improving. Patient compliance is improving. Chronic disease is better. Prevention is better. Just one thing after another. They're going to doctors' offices and RICS kinds of facilities instead of the emergency room. They're buying generic drugs instead of name brand drugs. The evidence is in, and this is working. But very few people in Washington are paying attention.
One of the things just as a tactical thing, I'd like for them to actually show us the savings before they spend it. That would be a very easy principle to try to ask them to do. If you believe that all these delivery reforms are actually going to amount to real dollars, show us the dollars, and then let's revisit what we do with those dollars afterward.
Yes, sir.
Yeah, I want to corroborate what Greg just said, because as a patient, the only problem that I have right now is that the government's in my way. I actually live in Washington State, and because of the mandates that there are on insurance policies, the health level mandates, I can't even buy the insurance product that I want to buy. I want to buy a high deductible, and my premium would go way down if I could buy that product, but I can't do it. So if I could go to another state and buy it, or get the government out of my way, that's my big problem as a patient. The other thing that you mentioned is like the market is doctors. I represent physicians, and doctors are bailing out of the system, and will continue to say. And the reason they're bailing out of the system is the hassle factor. It's not just about the money; it's the hassle factor, which will only go up with more government. And if we have if the doctors aren't around, then the system's going to collapse.
Yes, here.
Hi. My question is, when we're talking cost effectiveness, do you anticipate the number of abortions going up since it would be cost effective technically to have abortion over caring for the
I have no idea what happened to abortion, but if you think about it, there's 65 women in the UK that get cervical cancer before they're 25, and they made an economic decision. It was cheaper, and it was okay that those 65 women get cervical cancer instead of spending the insignificant dollars it costs to get a pap smear test, because overall it would be cheaper. So those decisions have been made.
And I would just argue, too, on the mandate side, we just had the Health Committee, the Mikulski Amendment, was trying to get knocked down through numerous amendments yesterday, and they held them. So it's not just the comparative effectiveness, it's the mandates that now everyone, American taxpayers, are going to be funding things that they find unacceptable, and that you will have no control over. So it is an issue that could bleed, and I think you raise a good point on comparative effectiveness as well.
Death is always cheaper than treatment, too.
Right.
I mean, I have a couple of quotes from Stuart Altman and Bill Roper saying, reducing healthcare costs is simple. Stop providing services. And these guys are serious about it. They were not being ironic.
Right at the back here. Yes, ma'am.
Not only do you need the House of Public Comments, but one thing on the mandate thing you asked what the next thing is, I think we need to also be talking about it not just from a concern about individual or employer mandates. We need to be talking about it in jobs, because that's what people care about right now. That's what the economy is about. That's what they're concerned about. They're concerned they're going to lose their jobs. If we want people to pay attention to the healthcare thing, some of them are, some of them aren't. Talk to them about if they pass this mandate, some number of you are going to lose your job. If you lose your job, would you rather have this free healthcare coverage or your job? And most of them would rather have their job because they can't put food on the table, they can't take care of their kids if they don't have a job. So we need to make sure that we aren't just talking about this within the healthcare sphere, we're talking about it in ways that our grassroots and that our people back home actually understand. And right now, that's jobs.
I completely agree. No one starts a business to say the first thing I want to do is provide health insurance to my employees. They say I want to provide this service, I want to build this product, I want to do something like this. So you're absolutely right. All we'll do is we'll keep pushing jobs outside of the country. Because if anybody goes to Walmart, nobody says, well, gosh, I want to buy that product because it's made in America versus the product that's made in China. And so now we just increase the chance that we're going to buy all products made outside this country because it'll be too expensive.